helping your wife is a choice. It's the sunnah of the Prophet ﷺ. If you do that, definitely you are going to get.
You need to start with being medically fit, especially if you have a health condition.
I lock up myself in the restroom and I gorge myself with a bottle of a drink. Who's gonna know I did that? Nobody. But then I don't do that.
Engage yourself in charity. It cleanses the soul.
What do you think about our naan bread and chicken kebab? Beautiful. Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to another captivating episode of Ramadan with Hollandia, a show dedicated to addressing some Ramadan challenges and sharing easy to make recipes for this holy month. I am your host, Asma Gambo. On today's episode of Ramadan with Hollandia, we shall be looking at how to manage medical conditions during Ramadan. Fasting is one of the most beloved acts of worship to Allah subhanahu wa ta'ala. But what happens when you have a health condition that makes it difficult for you to observe the Ramadan fast? Today, I have with me Dr. Zainab Adam Yaro to discuss the topic. Shirin zai ci gaba bayan mun dawo daga hutun takaitaccen lokaci. Ku dakace mu. Thank you for staying tuned. Today we're exploring the topic managing health conditions during Ramadan with Dr. Zainab. Dr. Zainab, you're welcome.
Thank you.
Yaya Azabi.
Alhamdulillah.
Let's dive right in. Can you tell us why it is important to be medically fit for Ramadan?
Now, in as much of the month of Ramadan is a month to replenish the soul, the body and all that, but it's also a time where there's depletion. So before you start, you need to start on a clean slate. You need to start with being medically fit, especially if you have a health condition. So perhaps you're diabetic, you need to make sure your glycemic control is good. You need to make sure that your medication can be taken at the right time. If you have hyperlipidemia, you need to make sure your cholesterol levels are, in check. Even if you don't have a health condition, some people think they're healthy. Well, in the real sense, they might not be. So that's the time to get your yearly checks to make sure everything, it's on ground zero before you start fasting, because fasting can affect your hydration status, your nutrition, general biochemical changes in the body. So you need to make sure you're physically fit to embark on this spiritual journey.
So you mentioned some medical conditions. I would like to know now, what are those common medical conditions that make fasting difficult?
There can be certain health conditions that interact with fasting in a variety of ways. So talking about metabolic conditions like diabetes, hypercholesterolemia, you're looking at gastrointestinal conditions like peptic ulcer disease, inflammatory bowel disease, gastroesophageal reflux disease. So these are things they're the commonest ones really. Things like migraine. Uncommon ones could be like eating disorders, things like that can actually impact your ability to fast safely during Ramadan.
I know a lot of people suffer the diabetic disease. So how would you advise a diabetic patient to manage this condition during Ramadan?
So first things first, you have to understand where you're at in your diabetic journey. Okay. So whether you're eligible, so to say, to fast during the month of Ramadan. So like I said, you're looking at your glycemic control. So you're looking at your control in the past 3 months. There's a test you can do for that. You have to look at your medications. Are they the types that make you have low blood glucose level, like hypoglycemia? And in the same vein, do you have hypoglycemic awareness? That's people that know the signs and symptoms that come with low blood glucose, because in the real sense, it's more dangerous than when it's very high, because you can easily become unconscious and things like that. So you have to be aware of that. You have to know if your medications can be adjusted, to suit the pre-dawn meal and then the iftar meal, things like that. So it's a time you have to talk closely with your healthcare provider to make some adjustments, to make personalized care plans for you during the month of Ramadan.
Yes. And in the event that your medical practitioner does not okay you to fast, I know that you are exempted from fasting.
Well, yes, analysis have been done in the past. We categorized diabetic patients into 4 levels. Okay. You have the first and second level, which says you're not okay to fast, regardless, and then the third and fourth, you can fast with some modifications, So it's best to to listen to your healthcare provider. Even Allah subhanahu wa ta'ala has, made provision for that. There are other ways you can get the blessings and, the rewards of Ramadan. It's not just about and it's not just about fasting, it's about increased Quranic studying, increased devotion and all that. So you have to listen to your body as well.
So, doctor, I know we've mentioned diabetic patients. Now, let's talk about those that suffer from ulcer. What would you advise them to do, like in terms of their eating pattern or habit or the kind of food they eat for sahur and iftar?
Okay, with peptic ulcer patients, we've had so many scenarios where people say, oh, I can't fast because I have, peptic ulcer. In the real sense of it, it can be a double-edged sword. One hand, fasting can aggravate and worsen the symptoms, while on the other hand, some studies have showed some sort of improvement in the healing process of ulcer from prolonged fasting, but we won't delve into that. So now, in terms of what you eat, my first advice would be not to skip the pre-dawn meal, which is the suhoor meal. People tend to skip it. My advice would be not to skip it and to indulge in foods that have low glycemic index and are slowly absorbed so that you have a long time before it wears off. So things like oatmeal, like yogurt or bananas, lots of water regardless of your health condition. And when it's time for the iftar, a lot of people, it's their time to feast, you fast and then you feast. You have to be careful in your selection of foods. You have to start perhaps with dates, as the Prophet Muhammad ﷺ would do, because it's very rich in fiber, it's a rich source of carbohydrates, or you just go for fresh fruits or vegetables, not the acidic ones. Avoid, because the acidic ones will worsen this whatever is going on in the stomach, because it's the acidity of the stomach that worsens the symptoms of ulcer. Then you should avoid spicy, oily, and processed foods, because this again can worsen, the symptoms, and it can slow the wound healing. And so you should just indulge with foods that are mild and soft on the stomach. That would help during the iftar, and eat in small quantities, not to, like I said, feast all at the same time.
Chew and let it digest slowly.
Yes.
Okay. So another one again is migraine. I know I suffer from migraine. Sometimes it prevents me from fasting. What would you advise for people with that condition to do?
So with migraine, a lot of times hydration is key. Because hydration helps with the symptoms as well. And then taking your meds pre the fasting window, and ensuring a lot of fluids, then avoiding strenuous activities. Some people don't like a lot of light, a lot of noise, and thank God it's a time for reflection and, increasing your dua and all that. So it's time to just be in a peaceful place and just make sure you hydrate and take your meds before the fasting window begins.
I will particularly take that advice, inshallah. Okay, we'll continue this discussion when we come back from the kitchen corner. Welcome back from our kitchen corner. Doctor, what did you think about our pancake?
So for every time I've made pancakes in the past for my kids, I would always use liquid milk. But today I think the top secret is to use the Hollandia milk powder, which I think gives it a different consistency and look. So I'm definitely going to try this.
Inshallah.
Inshallah.
MashaAllah. Earlier in the program, we established that there are some medical conditions that can make fasting difficult for some people. So let's get back to our discussion, Doctor. There are varying scholarly opinions on how breastfeeding mothers as well as pregnant women can manage that condition during Ramadan. What is your medical advice for them?
That is actually a category of people that have been, so to say, exempted from fasting on various levels. And every pregnancy, every delivery, every postpartum period is different for different people.
Absolutely.
So the key thing is to listen to your body, know what your capabilities are. Now, personally, during my pregnancies, I fasted. I think the first one I fasted 28 days, except for the last 2 days. The second, I fasted, I think during breastfeeding, I can't remember clearly now. But the truth is, it's doable. All you need to do, like we've mentioned in the beginning, is to ensure that you don't skip the pre-dawn meal. You eat foods that have slow absorption, hydrate yourself, because you're indeed eating for two, even as much as we say, it's an old wives' tale. And then during the iftar meal, try to eat things that are nutritious. Don't take caffeinated drinks or things that just have high sugar and give you early satiety to make you feel full, that later on you begin to get hungry. And at any point you feel like you can't go on, it's a time for you to stop. Again, Allah subhanahu wa ta'ala has made it easy for all of us to, fast or not fast, and then the alternatives to not fasting and still getting the rewards, completely as every other person that was fasting.
I like the fact that you mentioned when you cannot go on, of course, you can just drop the fast as long as you genuinely know you cannot go on. This leads me to the next question. In terms of a medical emergency and you're fasting, what should that person do?
It depends. The question is quite loaded. It depends on what medical emergency, because as with medical emergencies, each and everyone has, a different means of correcting it or addressing it. So the key thing again is to know what your health condition is and to know what to do in terms of an emergency. So perhaps you have diabetes and you're on a medication that brings about low blood glucose level. You should be hypoglycemic aware and should know what to take. So if you're hypoglycemic, you should have a sugary drink always available, or just sugar cubes, If you are hypertensive and you suddenly check your blood pressure is very high, you should have the meds that lower your blood pressure that has been approved, prescribed by a medical professional. So it depends on what medical emergency you have, really. That will now, inform the decision on what to do when there's an emergency. So there's no blanket, answer for that.
Doctor, let's go to my last question now. As a Muslim doctor, what advice would you give to people who are unable to fast due to health problems?
As a doctor, I would say that ensure you talk to your healthcare provider about the possibilities of being able to fast safely. If you're not cleared, do not feel deflated. Then as a Muslim, I'll tell you that it's quoted in the Quran. If you look at Surah Al-Baqarah, God has said, if you're unable to fast, you can fast other days. If you're unable to fast at all, there are other means, of getting the rewards, giving charity, feeding the poor, because indeed it's a time to, reflect and then, try to associate and feel what the less fortunate feel. And I would also advise that you look to your Islamic scholars, the ones you trust, to give you options, and tell them what your worries are, and they will advise you accordingly. And we shall all gain the rewards, inshallah.
Inshallah. MashaAllah. And with that advice, let's move to the last segment of the program, which is our Did You Know segment. Did you know that Hollandia lactose-free milk is the only locally produced lactose-free milk in Nigeria that enables consumers to enjoy all the goodness and benefits of milk without the discomfort of lactose intolerance? That is all we can take on the show today. Thank you so much, Dr. Zainab, for coming.
Thank you so much for having me.
But before you leave, I have a gift for you. Kawanna. Company Hollandia.
Oh, good. Oh, wow.
Your favorite?
Yes, actually my favorite.
Because I know she took it.
It's my favorite flavor, actually. Thank you so much. Now, good day.
Okay, it is on this note we bid you goodbye on today's episode. I am Asma Gambo. Sai mun haɗa wani sabon shirin. Ma'assalam.